Thank you so much, June and Beth, the FSH Society. I say this every time that I get to work with you all or speak with you all. This is one of my favorite groups to collaborate with. As you mentioned, I've worked with a lot of people with FSH, and almost every single person is involved in this society and advocating and connecting and supporting each other. And that means a lot to me to have a resource for the people that I work with. And I wouldn't really be here if it wasn't for meeting people with FSH. To be honest, it had to start somewhere. I didn't just pop out of PT school with all of this knowledge. I did do a lot of specialized training in neurology and neuromuscular disorders, but it wasn't until I had that first person that, you know, was really, who had FSHD and said, let's go on a journey, and I'll teach you and you'll teach me. And I'm so thankful for that. So thank you to you all for being a part of my own journey. And I don't think I really need to introduce myself. And because June, you did a great job of it, but I do really, really love neurology, and especially diseases that maybe are a little more rare that people don't know about. And I do love teaching it. So I even invited our PT community to join in this talk, because there's a lot of people that haven't heard of FSHD. And so I get really passionate to teach it to students. I teach it to 100 students every year, and I've been doing that for 12 years. So that's 1,200 more students that know about FSHD, 1,200 more PTs out in the world. And then I teach it to therapists who are out in practice now. And when I get questions from you all like, hey, can you connect me to someone? I try to connect them to somebody who's familiar with the disorder as well. So I'm just really, really happy to be here with you all. And I'm hoping that we can have a lot of good discussion at the end of this too. So one of the things I wanted to start off today with is to talk about some of the research findings that we do know, the clinical evidence for exercise and staying active in FSHD, and then put these into practice. Talk about the practical applications. I brought all my little like toys here actually. Talk about how we would like use things, especially when the gyms are closed, the pool is closed, how we could do some things at home. This is definitely what I'm doing for myself, doing a whole lot more at home. Hanging out in my office slash, I don't know if you can see that all behind me, my husband's music room. His extensive vinyl collection keeps growing during this quarantine. Every day something new arrives in the mail. But this is also my workout room. So amongst all of the guitars and records and DJ equipment, I'm rolling out my yoga mat on the floor. I'm doing my workout here just like you all. So we're going to talk about practical applications. Talk about how you might use telehealth physical therapy or occupational therapy. That's all we're doing right now. And it's actually been an amazing experience to do that more and more. And we're finding that some things actually work better in that setting, and access to care is increasing. So we'll talk about that. And then most importantly, I just want to talk to you. I want to hear from you. What are the questions you have? How can I help you stay active at home? So let's dive briefly into the research. I love this part because I've done a lot of clinical research, and I think it's important to know that there are really good research findings, and especially in muscular disorders. Back when I was in school, even 20 years ago, a lot of the what we were being taught is like exercise could be dangerous, or strengthening could make things worse. And now we know that's not really the case. So I want to review these pieces of research, a couple key trials as a jumping off point for what we might want to implement at home. So we'll talk about high intensity interval training, which is a huge thing just out in the world, and something I love doing, and it's been researched in FSHD. We'll talk about home-based training, which is great because we're all at home, and then another cool study that looked at aerobic exercise and cognitive behavioral training, which is also very accessible at home. I don't know about you all, but I certainly took my therapy, the psychologist I work with, and we're doing telehealth sessions, and I do them from my backyard swing. It's really quite lovely. Okay, so let's talk about this first trial. I really love this because I think it's really doable. But this group, back in 2017, this was published, looked at high intensity interval training. And they did it at home on a stationary bike. So I thought that's really great because, again, we're at home, and I think anyway, things are more accessible and practical at home. But they looked at a stationary bike, plus they did it in the clinic to monitor it, and did it over 8 weeks at 3 times a week. And here is what is really lovely. They did it for 21 minutes. And sometimes when you see some of the big studies and they look at really long periods of practice, it just seems like this mountain that's insurmountable. But 21 minutes seems doable. And I show one of the drawings from it here just so that you could see how they structured it, because this is also very doable, I think. They did an 8-minute warm-up. Then they did these little 5-minute intervals. And within that 5-minute interval, you can see this green, yellow, red. They actually had little 30-second times of increased intensity. Then they had a 3-minute of a lower intensity, and then back to these 5-minute intervals. It's one of the really nice things about interval training is that you're not going hard the whole time, but the benefits can be, in the general literature, just as good as some really high intensity training. So I like that this is really doable. What they found is that there was no muscle damage. So again, this is something that has really changed in our understanding of muscle disorders, that in FSHD, muscle damage doesn't occur with this kind of training. Fitness did improve. So that is exactly what high intensity interval training looks to change, is somebody's fitness, and it improved. Now, there were things that didn't change. Sit to stand, so a 5-time sit to stand, that's what that stands for. A 6-minute walk test, muscle strength, those things did not actually change. But I would say in this type of protocol, that's not what you're trying to change. You're doing a fitness protocol and you're improving your fitness. Now, and I would say improving fitness for fitness sake is a really great outcome. That's why I'm exercising, is to improve my fitness. And we know with improved fitness come things like I'm thinking better. I can't tell you how much better I felt after I did a run in the middle of the day yesterday. So this is one of the things I love, again, about this study. It's very doable. You could work these intervals. And in fact, a lot of the exercise bikes have these little programs built in. So you could work these intervals into your training. June, I want to ask you, I know I see some things pop up in the Q&A, and I'm happy. I'm used to teaching in Zoom, 100 students in Zoom. I'm happy to go through and answer questions as we go. Either way is fine with me. I do see this one. Will these references be available after the webinar? Absolutely. Let's get you the references for all of these. And I see another, I'm just going to go ahead and take these questions. Does intensity mean pedaling faster or increasing resistance on the bike? Great question, because it could be either. So in high intensity interval training, they're looking at using your heart rate or your exertion level, and that can come what I love about this, it's very specific to you. Your exertion level may actually go up way before someone else's. So it's very individualized, and it's based on your heart rate. And we'll talk a little bit about heart rate, but you could increase your heart rate by increasing the resistance or increasing the speed. And so I personally like to have choice with my exercise. And I, most of my interval training comes from running. So I could increase the resistance, as in go up a hill, or I could just run a little faster. And so you can actually do either when it's based on your heart rate and being in your heart rate zone. So I think that's a really, really nice way to look at it. And in this particular, with these colors, they did a red zone, which is in the highest heart rate zone, a yellow zone, which was 75 to 90% of their max heart rate, and then a green zone, which is 60 to 75%. And I have a slide in here actually looking at how you would determine what that heart rate is for you. But I live by heart rate training myself. I simply just use my Apple Watch to do it, but you can use many things. And what is nice is that it's individual to you, and you may increase your heart rate just by doing squats and sit to stand. So when we talk about like how you could practically do this, especially if you don't have a bike at home, I don't have a bike at home, what kinds of things you could do to get your heart rate up without equipment. So that'll be a fun discussion. Okay, so that was one piece, the high intensity interval training. Let's talk about this other one. And I even put just a little screen capture of this study because it was called Safety and Efficacy of a 6-Month Home-Based Exercise Program. And here they did 35 minutes 3 times a week for 24 weeks. And they did 2 sessions that were very aerobic based and 1 session that was more interval. And one of the things I liked about this one is that they looked at strengthening exercises, high intensity, low intensity on the bike as well. You'll see a lot of these studies, actually all of these studies are looking at the bike because it's very easy to control. And change and ramp up and ramp down. People started out supervised with this program and moved to independence. And here are some of the summary findings from this. So no change in quality of life. So typically a lot of the studies are doing some sort of questionnaire on quality of life, but they did find less fatigue, which I think is huge because that's probably one of the #1 things that I work with, or that people are telling me they have fatigue pretty much across the board in all neurologic disorders. Improved VO2 max, so that's the measure of fitness and aerobic capacity. This is what's also really nice is they actually found increased quadricep strength, endurance, and muscle fiber cross-section area. So that was looking in an MRI. So decreased fatty infiltrate, more muscle fiber cross-section area. And remember, in this study, they actually worked on strengthening. So that's a really great positive finding. They found people also had it, did really well with it at home. And again, I see a couple of questions, and please stop me if this is not okay, but I like go back and forth as we go here versus waiting until the end. And if it's going to take us off track, I may hold off on it. But let me look up here. June, is that okay?
Yes, absolutely. Go ahead.
Okay, thanks. So I'm just looking for Come Bike and elliptical, bowls that I use. Awesome. You're so lucky to have those at home. I try not to overdo it. good, because you really do need to listen to your body with it. But get the heart rate up a bit and generally spend 15 to 20 minutes. Is there a specific benefit or preference from your experience on the bike versus the elliptical? Great question. And honestly, you know what I say with these things is that this is like, what do you like the most? Because what you like is what you're going to keep doing. And I have found that some people love the elliptical and some people love the bike. Some people, like myself, get bored really easy and they need both. And like sometimes I'll go from the bike to the elliptical. Like if I'm at the gym, I can't stay on anything for very, very long. So it's great you have both. You might switch it up. They do work different muscle groups. And I think it's great that you have both options. And I think that's great. And 15 to 20 minutes, listening to your body, absolutely. And like you saw from that last study with the interval training, it only took 21 minutes. And then here's another question: evidence high interval aerobic training decreased atrophy. Here is some right here. So increase quad muscle strength and muscle fiber cross section. That's phenomenal. I think that's just fantastic news. And then another question: my glutes seem to always hurt. Can anyone recommend a seat to use on a bike that provides a lot of cushion? This is so common, and this is a tough one. I gotta be honest, I've tried things with people. We actually purchased, they make these gel seat covers that people use for spin classes. I purchased one when I was doing spin classes a lot, and they go over it and they're kind of filled with gel. That's been the best option that I've used. And we have also, this is very person specific, but we've worked with people before to do a custom cushion for things, like even a custom cushion for their office chair. There's another question, great, on the Facebook Live: what age group is this targeted to? So if we look at the studies here, and let me see if I have the age specifically. I might have to get back to you on that for a couple of the studies. But the inclusion criteria for much of the studies are 18 and older of people diagnosed with FSHD. And then another great question. I think these are, thank you guys so much. This is the kind of stuff that we talk about all of the time with our group of clinicians. What type of bike do you use if you're a full-time wheelchair user and have difficulty keeping legs from flopping out that is affordable? Oh my gosh, like we need to make that bike, right? Because we have this fabulous bike in our clinic, but it's like a $5,000 bike. That's certainly not affordable. It's got these amazing boot pedals that keep you strapped in. But what I would tell you, Katrina, if you can find yourself a neurophysical therapist, these are a creative bunch, and they will jerry-rig things with you to make this happen. And one of the simplest things that I have found, and this was actually with a patient I was working with that discovered that we found this together, and I got some of my little tools here, so I'll even show you, is using some things to keep your legs from flopping out to the side. So this is just a simple loop, a stretchy loop band. And I've used this, you put it over your legs, put it around your knees. And depending on the strength of these, it actually keeps your legs in and from going out. So if your adductors, the inner thigh muscles, are weaker, the legs are going to tend to go outwards. So we've used this to keep people's legs in. We've also worked with some companies to get special pedals for the less expensive bikes. So I just had a person who went and got a bike for home because he can't go to the gym right now, and a fairly inexpensive bike. And they were able to call the company and get pedals with more support. So they have a heel support instead of just the strap over the foot. And they talked to the person about their situation. and they gave them a discount of the pedals. So that was really helpful, I think, and I think companies are willing to work with people. And then Dan, great question. This is also so common. I use a brace to keep my left foot at about 90 degrees for foot drop. Should I pedal with or without the brace? And what I would say, Dan, is, are you able to pedal with the brace or without the brace? What's easier for you? When you're in the foot straps, the foot drop is less of a problem. And if you have some foot control, it's kind of nice to be able to pedal without it. But I will say, I have some people that keep the braces on for pedaling because it keeps their foot in position a little bit easier. And then Katrina, follow up. Okay, let me actually show you this band. I love these particular ones. It's called Power Systems, and it's called a loop band, but you can actually order them from powersystems.com. By the way, I'm not affiliated with any of these companies whatsoever. I just love their stuff. The darker the color, darker, is that the best word? Black is the heaviest. So that's where I would recommend, if you're using something like this to keep your legs together, use the heaviest band. If you're using it for strengthening, you would start with the lowest band, which would be, in this particular brand, is a yellow band. They typically go like yellow, red, green, blue, black, like kind of up the color spectrum, I guess. Oh, you all are so awesome. Thanks for the great questions. It makes this, what could be very dry research evidence, much more applicable. And this is how I live in the evidence. It's like, show me what we've got, and then how do I apply this to each individual person, and how do we make decisions and make this useful. So thank you so much. This is really fun. Okay, so one more piece here is a really nice trial done in 2014. And this looked at the combination of aerobic exercise and cognitive behavioral therapy, really looking to change fatigue. And we know that fatigue is multifactorial. And what I like about this study is they looked at it from a multifactorial way. So here they did aerobic exercise, 50 to 65% of heart rate reserve. And I have another slide that looks at how you actually calculate that. And they did 40 sessions of this. So this is a lot of repetition. And then they did cognitive behavioral therapy sessions, and a minimum of 3 of these where they addressed some big, important areas. And I'm going to give a like pre-shout out to my colleague, actually, Naoya Ogura. He's the OT that we work with, and he's going to do one of these sequester camp webinars in a couple of weeks. He does this, working specifically on fatigue, pain, and sleep. And it's really understanding your own beliefs and behaviors that affect those, and then how can you make changes with them. So so this was part of this intervention trial, and they, luckily, they were trying to address fatigue. They found that people had less fatigue. And as a follow-up to this study as well, this is actually, this quote here is from a systematic review that looked at all the pieces of literature. As a follow-up to this, they found that both the aerobic exercise training and the cognitive behavioral therapy combo also decreased the fatty infiltration of muscles. So again, really, I forget who had asked about that, like, does this have an effect on atrophy? Yes. So in this particular study, and remembering for all of these, that there's a lot of repetition in here. This was not like a one-time exercise trial. This wasn't even a month of exercising. This was minimum of 3 months or 12, actually minimum of 8 weeks. One of them was 8 weeks that people were doing this. And that's that's in the general literature for making strength changes and aerobic changes in general, that we need that amount of repetition to make those changes happen. Another thing, found a couple of Facebook Live comments, found elliptical impossible due to pelvic weakness. Absolutely. I have found the elliptical impossible for many things, and that is one of them. And so this is so individual of the piece of equipment that is helpful. And actually, probably the person I've learned the most from in my life as a clinician is a person that I worked with FSHD, who connected me to the FSHD Society. I've learned so much from him and his ingenuity of what has worked for him. He found a recumbent elliptical bike that was more comfortable than a standard recumbent bike, better than the standing upright, which was uncomfortable and too difficult to do. And I've had many people go and try out these recumbent ellipticals because they're not as well known, but that might be an option for you from the Facebook Live. And wondering if there's any info on how old. Okay, for older people, 55 plus. Absolutely, yes. So many of these studies did not have an upper age limit cutoff. So also safe for those older than 55. And again, I would say, this is so individual, because some of these things, we're talking aerobic exercise. And if, at our clinic, if we're going to start on aerobic exercise program and somebody has a history of a heart attack or other heart disease, then we actually want them to do an exercise test, a stress test, before engaging in an aerobic program. So we'll talk about this at the end too, but I think for all of these pieces, ensuring that this is safe for you as an individual is very, very important. And it might mean that you need a cardiology checkup before driving aerobic exercise. And that's just if you have a history of heart disease. Okay, so a little bit of summary here. We know that moderate and intense interval exercise is safe and beneficial. So most of this has been done, the aerobic and strengthening with cycling. I would say, I think, and I've found clinically, you can try it with other things, but the research study is coming from the cycling perspective. It can improve fitness and fatigue, and it can be very accessible at home. Great questions. Any exercise recommended to strengthen shoulder muscles? So glad you asked, because we're going to dive into some of the clinical pieces. Because there's not a research study on the shoulder exercises. So we're going to dive into that now. There is another question asking for a better view of the band that she uses. I don't know if I can make a better view of this. So let me like display it. It's a stretchy band. They're called loop bands, like a loop. And this particular one, and maybe I can even like send June a link for this. It's called Power Systems, and it's black, so it's really thick and heavy. There's a few other companies that make these. You can buy them on Amazon. You can buy a set of like various colors of them as well. Loop band. Okay. Great, keep the questions coming. Okay, so we'll get to some shoulder ideas, and talk about different tools and things that you could do at home. So taking these pieces to home, we've talked about getting that aerobic piece, bike, recumbent bike, and I'm just gonna say anything you can do to get your heart rate up. I love dancing personally. And if I'm at a wedding, I will turn on my little exercise thing. I call it other exercise on my on my Apple Watch, and I watch my heart rate, and I can be in an aerobic zone for hours while dancing and not even notice it. But and I'm also a runner. Like 10 minutes into running, like I am for sure noticing it. So I would say, oh my gosh, dance your heart out, get your heart rate up, watch what your heart rate is doing. So it does not have to be necessarily a bike or recumbent bike. And my advice to most people is to find what you love, but measure your heart rate with it to get it up. For strengthening, so for a lot of people with FSHD, we have to find some alternative positions to go through so that we're targeting the right muscles, not overusing some muscles and underusing others. And I put in a couple of pictures later here to talk through some of those things, but I also really wanted to advocate for each person to see a specialized physical therapist to set up that routine, to really finely tune and find what areas are weaker than others. Because what one person might do with a simple row exercise, you may need your arms lower or your arms higher or your arms out to the side to target the right muscle for you. So I do have some general recommendations of types of exercises, but I always say it's so individual, because what's helpful for one is not helpful for another. I'm also seeing some great comments here. A runner's belt works well. Bonus that it has little pockets for keys and credit cards. Yes, I love my runner's belt. That's a great idea. It essentially looks like this with little pockets in it. Somebody else said I use my adjustable SI belt. Yes, I love my SI belt. By the way, a very handy tool if you have pain in your hips and SI joints. SI stands for sacroiliac, but it's a like a mini back belt. It's also like this thick, and it has Velcro, and it's very easy to adjust. So that's another really great tool. Thanks for mentioning that. I've totally used that as well, and might even be easier for people, because this kind of thing you have to slide onto your legs. And then from a stretching standpoint, I get asked this a lot as well. One of the key things, and again, I highly recommend you seeing a PT, is to not overstretch certain things, because that can actually change your mechanics enough to throw you off balance with certain things. And this is especially true with the hamstrings, I would say. If those end up getting overstretched, but they're weak, then that can lead to some instability for you, especially at your knees. So I'm going to throw up here some easy home equipment things, and I brought as many as I have with me here. So using the bands for strengthening, I love. So the loop bands, or I'm sure many of you, if you've been to physical therapy, bands such as this. So I've started keeping these with me near my desk, because I'm at my desk way more than usual. And let me just bring this down here slightly. Something as simple as a band here, elbows at side, palms up, and an opening. Oh, this one is so helpful, especially if you're sitting at a desk a lot. So an opening like this. Now, I'm gonna say, do a disclaimer here. This is not for everybody. So if your shoulder, for example, is sliding forward, that might actually cause some pain. So again, this would be really, really individual. But what I wanted to show you is something very, very simple. I love to just incorporate things throughout the day. And that is one, and you might even do it without a band. That is one right here that is a really nice opener. That's the opposite of sitting at a computer if you're doing that a lot. Is hydration best? Ooh, okay. hydration best with water or other liquids like Gatorade. This is very, very specific as well, because I think it depends on your own makeup and how, your own chemical makeup that is, and how hard you're exercising. So I'm, I'm a water person, for sure myself, but when I was training for a marathon in the summer and it was hot and I was sweating like crazy, I needed a little bit more hydration. So this is something that you're going to have to gauge yourself based on what your body really needs. Dan, good question. And I particularly like we keep some of this at the clinic because some of the people that we work with neurologic disorders actually get low blood pressure, and low electrolytes. And so there's some really nice drink mixes that they don't have all the artificial colors and things. And so I like that because then you can gauge how much you add to your water, and it doesn't have to be super sweet. And it kind of saves you some money. So I'm particular, again, I don't advocate for any brand, but I like things where I can add it to the water. So that's just my particular favorite. Okay, so bands, and again, different colors. So green, you can even see it here, is thicker than this orange. This orange one I can pull apart a lot easier. Weights, really, really light weights. I can't even tell you. I don't have it right here at my home office, but they sell ankle weights where they're adjustable. So they have little like half pounds or even quarter pounds that you can take in and out. And when I've worked with people with FSHD, if you have a lot of weakness, it's handy to start weight training with a half a pound of weight, for example. So those I've recommended, and I've had people get. Haha, Ray, that double tape tennis ball looks interesting. What do you use that for? I was just going to get to that. So let's hop ahead to the tennis ball. I put one on there. This is how I keep it at home. Super cheap, simple little thing. Tennis balls wrapped in duct tape. And I love this for some soft tissue work. So if you've got some tightness in some muscles, but in particular in the spine. So I'm going to show you here. Let's see. You would take this, and it's probably going to be best for me to kind of show you on here. This center part goes right in the center of your spine, and these two little balls go on the side. So if you're rolling on it, you could imagine rolling on it, and maybe I'll show you on my foam roller, because the foam roller is one of my favorite things as well. So this is your back. You'd be rolling on it like this. You get a nice massage along the muscles on either side of your spine, but not too hard. So you imagine you're laying on it like so, rolling on it like this. And it can be really nice if you have some tightness in the center of your back. If you're on a computer like I am, so this is why I have this at home, I'll take a little break and roll on this, kind of just let my arms open up my chest, and use this in the center of my back. Super cheap, super easy, and it's still kind of soft because it's a tennis ball. So that's the tennis ball for you, Ray. And then the foam roll, one of my favorite things. And I have even been using this, and I've done this with a group with FSHD as well. Let me get it situated on my chair here, but just using it even in my chair as a cue behind me for my posture. It opens me up a little bit. So if you kind of see from the side that instead of being here, I'm here, I can bring my arms back, get a little bit of a stretch, even get my head back and get a little stretch, just even in sitting. One of the things I also like, and I have a picture of this as well. Let me maybe even just Yeah, it's in the next slide. I'll come back to a couple of the little tools there too. So one of my favorite things to work on when there's some decreased control in the abdominals, maybe there's some back pain, but we're working to use those deep muscles that you have in the abdominal area that you might not have even known you had. Oh, how funny. Carol even asked this. Who knew, Carol, we were going to go right into abdominal muscles and strengthening? This is often the first piece. So especially if you, like many people in the world, have a curve in your back, so more lordosis, we might want to work on strengthening those muscles. And I like using this as a little bit of a cue. So you can see from this drawing here of our wonderful therapist, Allie, that this is her pelvis tilting under, and then this is with that curve. And moving between those is actually a fine control of your abdominals. So I like to use the foam roll here. Let's see if I can get a little more of my body here. So with the foam roll here, what's nice is I can actually draw in, kind of scoop my pelvis under by holding in the abdominals, and the foam roll gives me feedback. So if I'm sitting in a big curve at my back, I'm not hitting that foam roll. When I contract in and pull up, and I can even pull up through my pelvic floor here to do that, then I can get a nice flattening through my back, contraction of my abdominal muscles, especially the deep abdominal muscles. So it doesn't need to be like a sit up or a plank or anything like that. A very simple pelvic tilt. And again, I like to use a little feedback from the foam roll to get that started. Excellent to do anywhere, in an office chair, wheelchair, even in bed. You could be doing this type of exercise. Let me pop back to a couple pieces of equipment here, and then we'll make sure to get to some questions and answers. Oh, and I did have a picture of a couple of arm options. So let's see, stretch strap. So there's a little picture here of the stretch strap. I like this. Again, I'm not affiliated with any of these companies. It has all these different loops so that you can take it on different parts of your body to do a self stretch. I love Nordic walking poles. That's in here. So if that's available to you to walk with a device like that, it actually increases the aerobic drive for your exercise because you're using arms and legs. Different massage tools. This one is my favorite. They now make a smaller one, a mini one, and it's black and it looks like the Death Star. It's pretty cool. But I just wanted to show you, you push a button on it and there it goes. It turns on, and then you're going to probably kind of hear it. It actually vibrates like a massage tool. And what's really nice about it, and I don't know, my voice is probably vibrating now. It has 3 options for speed, but you can roll your own body on it. And that's what I love, because that, you know, I don't have to rely on my husband. My kids are certainly not going to do it. And this I can do. I can put it on the bed and roll any body part on it to roll out muscles that are sore. And I really love using vibration for that. Carol, thank you. This was the last piece we had on here. Can you speak about abdominal bracing? Yes, I can, because I feel like it's underused, to be honest. And I think it can be really, really helpful. So something as simple as an elastic abdominal binder can be helpful to help turn on some of the muscles, help relieve some of the back muscles. help you activate muscles even. Some people are afraid to try it because they feel like, oh, well, that will make you be weaker. But often with the bracing, it actually helps you turn on some of the muscles that you have and then support other muscles that might not be as strong. There's lots of different options for the bracing, and most people, I would say, are more comfortable with it over some piece of clothing, like a tank top or something like that. It's the discomfort of it, I think, that tends to discourage people from using it. And so I always tell people, try a few, because there's softer ones, there's ones that are easier to tighten if your arms are weaker. They make all sorts of options for these now, and almost all of them are on Amazon too. So that's another one to explore. So I've given June these slides, and June, I don't think the references were on there, so I do want to make sure to add those. I have a ton of resources of different exercise videos that can be used, some of my favorite Tai Chi things, some of my favorite pole walking things that I've been giving to people to use at home during this time. And I did promise to show some arm options, but there's a couple more questions here. I may try the tennis balls. Could be difficult to roll them sitting in my wheelchair. So yes, but I have people have done this in their chairs. So I know I have like many things going on right now, but on the foam roller, if I get those tennis balls, I can actually roll a little bit side to side with them, and I can bend forward and back over them. So that's what I would recommend in a wheelchair. Brands of abdominal braces. So Colette, this is, I don't have a particular brand, I gotta be honest. I haven't found just one thing that I love, and I think that's because everybody's so different and individual in their body types and needs and sensitivities and things like that. So we often we have a couple of types, just very basic types we try at the clinic, and then I have people explore other options. And this was the last piece here is, if you have more arm weakness, you're often finding that the traditional exercise that you might do with the band, that you might do with weights, just doesn't work for you. And we set up a lot of supported arm exercises. So in this particular one with our therapist, Chelsea, she was demonstrating a series of slides that we use for scapular control while sitting at a table. And you can actually add resistance to these, which I think is really nice, but your arm is supported. And so for a lot of people, this is not the type of exercise you're finding on YouTube, but this is the type of exercise that you would need to keep using the scapular muscles and shoulder supporter muscles that you have, but in a safe way. And you can add weights to these, and you can add bands to these, but you're supported. So I just wanted to bring that piece up because somebody had asked about arm exercise options. So another question that came up, I have a back brace. It throws off my balance, but feels good. How long do you recommend wearing? Oh, good question. And when it feels good, gosh, keep wearing it. Now, one thing I would say, so something to think about with the back braces is blood pressure. So it can increase your blood pressure, and typically blood pressure also goes up as you lay down. So I wouldn't wear a back brace laying down. I would just use it in sitting and standing. And if it throws your balance off, you would have to gauge whether that is safe for particular situations. And like, is it throwing your balance off enough to fall? or do you need to make some changes to what you use while you have it on? So I just realized I'm still sitting on this. It feels so good though. I should do all of my sessions with a foam roll behind me. That for the brace, it maybe you need to change how you're walking a little bit. And this is something that I find when adding any kind of thing. So back brace, Carol's asking about foot drop. So even bracing for foot drop might throw your balance off a little bit, and you might have to relearn some of your walking. And that might be what you need with the bracing as well. So exercises for foot drop. So one thing that I always recommend for foot drop is to get fitted for a brace, because it's going to help you walk longer and safer and use the correct muscles. At the same time, you absolutely can keep using and strengthening the muscles. So foot drop is caused by weakness of the anterior tibialis or dorsiflexor muscles, so on the front of the shin. And if those muscles are difficult to lift against gravity, so if you're just sitting, my hands are my feet here, and just doing a toe lift, if the muscle's too weak to do that, we might need to do it in a different position. So when we think about muscle strengthening, this is true for the arms and really any body part, it's most difficult against gravity. So then you may need to go on your side and do that motion, because that now you're moving in the plane of gravity. So you don't have all of that weight of gravity pushing against you. So lying on your side and the foot coming up like this, that might be where you start. You might even be able to do resistance. So even these little loop bands are super handy for the toe lifts. Let me see if I can demo this for you all. And I just realized that we're at the hour mark. June, is it good to go over?
Yes,
okay to go over a little bit?
Go
Okay.
on. We're all
Okay. Okay. I might have to do some interesting things here for my that you can see my feet. No, that's my desk. Okay. Okay, I'm gonna do it this way. This is a problem of having really long limbs. I'm gonna bring my feet up this way for you. Okay, here's a foot. I'll put them up on the other part of my desk here. Here's another foot. Crazy things that you do. I have this little journal I'm keeping of crazy things that you do during this pandemic, and here's one of them. Okay, so that little loop band, if I don't roll away here, if you're on the floor, you can actually use the resistance of the other foot to press one down and one up to strengthen the muscle for foot drop. Now, if again that muscle's really weak, if you're lying down, then you won't be fighting gravity as much for that particular exercise. Okay. And you don't need to get in that crazy position I just got in, for sure for that. Okay, so a couple other questions here. Can you give recommendations on how an abdominal brace should fit? Boy, I wish I had one here to show you. So this is something you may want to get fit for with a therapist or an orthotist. Like, we work with orthotists pretty closely to get these fit, but I'm going to show you with this green band, which is a little bit smaller, where I like to fit the abdominal brace. And I like it, the tightest part to fit on the lower abdominal. One of the pieces that becomes really uncomfortable is when it slides up high and it rubs on the skin. So they're typically like 2 times the size of this, right? So I would get them fit and tight on the lower abdominal. Now, it's helpful when some of them have, they have little pieces on the side that you can pull out to tighten them. because when you have upper extremity weakness, especially for pulling across, it's hard to get the abdominal binder tight enough. So you'll see them on Amazon. They have little pieces that pull out to the side that I found easier for tightening. They're like usually little strings. And if you have scoliosis or back pain and some other things, getting fit by a therapist and an orthotist is really, really helpful. Okay, I see 2 sets of questions here. So, love the most flexible toe off, but I can't use it to drive because it's too restrictive. Any recommendations for a foot brace for driving purposes? Yes, Katrina, I agree with you. So the toe off braces are awesome for walking and getting around and clearing objects, but they might not allow you to push down enough for driving. So again, I would recommend working with an orthotist for this. I have had people who literally like take their brace and their shoe off while they drive and put it back on when they get out of the car. That's not always convenient, I know. But there are new braces and technology all of the time. And there's always this trade-off of stiffness, which helps you clear your foot, but doesn't give you enough flexibility. And it may just be like one step down for you that would be enough. And an orthotist would be like, I love working with orthotists because they have all of these. They have different sizes and samples, and they'll try them on and literally have you try it and go in your car, or try it and walk and all of those things. So that's what I would recommend for that. I'm seeing from Ray, those arm exercises look great. I'll definitely try those. I'm missing my twice weekly pool workouts. Yes, that's one of the biggest things right now, Ray. I feel like people are missing just their regular thing, especially if it's a pool and the pool's not in your backyard and it's closed. The YMCA, the gyms, all of those things. I agree. And so that is one reason why something like the arm exercise that I showed is actually kind of like being in a pool. If you're supported by a table or bed or counter like that. And Ray says the foot drop exercise is great. I realized how awkward my position was on there. Yeah, so simple, such simple little exercises that you can do. All right, I have all of this with June here. I did want to just put a plug to reach out to your therapist for telehealth. We've been doing telehealth, as I said, and I think it's a great way to work on a program that's directed to you. There's a couple more questions that came on here, June. I have a back brace through my PT called Aspen Horizon. Very helpful, but the balance wearing it, ... I know. This is where I tell everybody, like, you get a brace and you feel so good, but then you need training in the brace because you're adjusting to a new body. Same thing for orthotics. Same thing for assisted devices as well. Can you share your thoughts on weight training for strengthening, Frank? Absolutely. If you can weight train, do it. And I would use things as simple at home as your water bottle, as a band, if you don't have weights with you, but starting very light if needed and getting some individualized prescription of the exercise so that you're using the right weight for the right muscle. So like I mentioned, the half-pound weights, the pound weights, as something that's very appropriate for some of the shoulder stabilizers and scapular stabilizers. I mean, I do a lower trap exercise. The lower trap is that muscle along the bottom of your shoulder blade. I use a 1 pound weight for that because that muscle's very weak for me. So getting something pretty individualized for yourself, Frank.
Well, fantastic. I don't think anybody minded going a little over time there. That was just, there was so much information, and I'm sure we all enjoyed it. And guess what? I've been like doing my
Julie, I went and got the foam roller and put it behind my back while you were talking.
Oh my gosh, it felt so good. I haven't done
I'm going to go do that in a second. So,
I'm going to present like that. Thank you.
So I think we all got a lot of benefit out of that. I hope we can have an opportunity to do it again sometime, but I think we should probably wrap for today. I will be posting a PDF of these slides and with the links to all these helpful other videos and so forth. I wanted to quickly mention next week, same time, Thursday, 1 p.m. Eastern time, we will be having a presentation we're going to be talking about research. And this one is very cool. Many of you have heard about machine learning and artificial intelligence. Well, this is a pilot project that the FSHD Society funded to apply machine learning algorithms on FSHD natural history data sets to see what insights can be gained, what kind of potential this might have for the future of better understanding FSHD. So be sure to join us next week, and I'll now turn it over to Beth for any final remarks and announcements. And before I go, thank you so much, Julie. That was tremendous.
It was
Thank
amazing.
you for having me, June. And I put my contact info if people have questions or anything like that.
Awesome. Thank you so much. Thank you everyone else too for attending our Sequester Camp webinar today. Very, very special thank you to Dr. Julie Hirschberg. You're the best. We love you. Just know that we're going to be updating our Sequester Camp webpage with these recordings like June mentioned and all the other information as it arises. So please check back there often. I've posted the link to the webpage in the chat. You can grab that. Know that new on Mondays at 3 o'clock Eastern, we're going to have weekly Zoom fitness training sessions with our longtime FSHD Society member, Bill Herzberg, and his trainer, Mitch Wade. If you saw them this week on Monday, really cool. Mitch gives his PT advice, and then Bill experiments with it and demonstrates it. So it's really a cool afternoon. Also still on Wednesdays, Belinda Miller is broadcasting her weekly children's book reading at 2 o'clock Eastern on Facebook Live. And then, of course, our wonderful radio show celebrity, Tim Hollenbach, is still hosting his weekly shows on Wednesdays at 9 o'clock Eastern, 9 o'clock p.m. Eastern on Facebook Live. But you can also dial in and chat with Tim during his show. So keep an eye out for email updates announcing this really cool webinar that June just mentioned next week, and then following subsequent webinars every week. And we're just going to keep this up until we don't need them anymore, okay? So we hope to see you again next week. Please take care, everyone, and please, please, please stay healthy and stay home. Thank you.